Okay, so we're going to go ahead and get started with our buzz session this evening. And let me just start off by, saying once again that the purpose of the meeting tonight is really for us all to work together as a group to help you sort of brainstorm your ideas for your interventions for your project. So hopefully the outcome tonight is going to be that you will have been able to fill out that measurement worksheet that's in the buzz session assignment. Do you guys have that all pulled up, or do you have it where you can pull it up on another tab? Or it'll be nice to be able to refer to that, and it's kind of at the bottom of the instructions for tonight's assignment. Also, you may just want to take notes on paper because this is going to be a great time for you to go ahead and fill out the interventions and the measures for your for your 4 ramps. So it can be a really helpful experience. So the way we're going to start, let me see. Hold on a minute.
Interrupt. I just got a message from Stephanie. Did anyone else get that? She said, "Hey, I'm sorry. I'm so sorry. I think I'm out of the loop."
Okay. Let me join. Let me invite her again.
Okay.
And it's Stephanie Walker, right?
I'm not sure.
Well, that's how. Okay, let's do that. I sent it again. Let me give them a. Let me just go over here. Stephanie is lost. Thanks for answering her. Okay, let's go on. We're just going to continue. Hopefully she'll get in. Okay, so what we're going to do is I'm going to have each of you just take about 5 minutes, and also please just chime right in if Stephanie keeps talking to us. I have to switch to my other screen to see that chat. Anyway, I want you each to, in about 5 minutes, tell us just briefly about your setting, the topic of your project, and the gap in evidence-based practice that you've identified through your literature review, and then your the experience with that evidence-based practice assignment. Okay. Let's see. Let me look over here one more time. Can try inviting her one more time, and then we're going to go ahead and let somebody get started. Okay, so does one of you want to go ahead and start and just tell us a little bit about their project and where you are, what you found at this point? Any volunteers?
Sure. I'm Kayla Lawrence. I am a midwife at New Birth Company, which is a freestanding birth center here in Overland Park, Kansas. And the focus of my project is going to be LARC contraception with more of the patient education component of that. What I have found is we don't have anything as far as patient education for our clients. I had one mom tell me that she had gone to Planned Parenthood for her birth control because she didn't realize that we offered that service. So I'm gonna focus on that, and then when I got into the research and what we're supposed to be doing as to what we are, some of it like the I found a guideline that talks about what needs to be, like the women should be offered all forms of contraception that they're eligible for, and that women considering LARC should have detailed written and verbal information available to her to help her choose what she wants, and that us as providers need to be, competent in the counseling, of women and placing these devices. And currently, only one provider at the clinic places Nexplanon. Nobody does IUDs. Just one, and Nexplanon is the patient's only option. We don't have anything for show and tell. We don't have anything for education. So that's kind of going to be my focus, to get some buy-in from the other providers and more than just one person offering one device. Even if it's just one other person and myself that will offer these to women. And then I want to tap into some of our childbirth education, because we don't stock currently. It's kind of cost prohibitive. We don't stock the devices. So if a mom does decide that she wants one, it can be weeks of going back and forth with her insurance company and getting her pre-certified. And if we can get her aware of the best, like ACOG said, LARCs should be considered, first line. And if we can get the mom to tell us that she wants that at her, before she has her baby, well, then we can start the process before she delivers. So then by the time she's 4 weeks out, we'll have it, we can place it and just move on. So that's kind of where I'm at. And my patient tracers, I talked to the 22 patients I saw just one day in the clinic, and the overwhelming majority had no idea what their birth control options even were. And almost all of them agreed that having more information would be very, very helpful in their decision-making process. So that's kind of where I'm at as far as what I'm doing.
I have two quick questions.
Mm-hmm.
How many nurse midwives do you have there?
4.
And so that's the total number of providers is 4?
Yeah.
And with your patient tracer, did you talk to women at any particular point in their pregnancy, or was it just wherever they were?
All over.
Okay.
They range from 9 weeks to 40.
Okay. So there was nothing
No,
Okay.
there was nothing. I think what I'm going to try to do on our new OB patients, there is, in my chart audit, there's a line that says contraception, and the only thing we put there is discussed. Okay, well, what did we discuss? What did we do?
Okay.
And I think if we would get them, we have one education thing. It is a sheet that lists all forms of birth control, from condoms all the way down in order of efficacy. And I think if we would even just give them that piece of paper at the new OB and say, hey, here are your options for postpartum. Nothing, or, all the way down to the Implanons and, their IUDs. And at least plant the seed there that we can revisit at future appointments.
Okay, we're going to get back to that. So, okay. One of you want to go next? Elaine or Marissa, who wants to go next?
I'll go.
Okay, go ahead.
Thank you. I live in Miami, Florida right now, and my site location is actually at the Planned Parenthood that I work at. It's a family planning office. And the focus of my project is on promoting safer sex practices and risk reduction strategies for sexually transmitted infections. And I initially thought that I wanted to focus my project on promoting expedited partner therapy prescribing among providers within my clinical site to hopefully help reduce infection rates and reinfection rates of chlamydia and gonorrhea, trich, and so on. But after doing my gap analysis and my audit tool, I really realized that I was narrowing the scope of my project a little too much. And in comparison to how many patients we have with chlamydia, gonorrhea, STIs, we're hardly prescribing expedited partner therapy at all. So I do want to incorporate that in my project, but I don't want to that to my project. So since then, I've expanded my project not only on promoting expedited partner therapy, but also to try to look at system change and expansion of promoting STI prevention. So I found a few toolkits that I'm working with, and we will see. I already know I'm gonna face barriers in regard to providers. For one, I work at a Planned Parenthood. We see a lot of patients on a daily basis, and it is going to be more time consuming to go over some of the education with them, go over some of the screening questions with them. But I know that there is a need, even from just talking to my patients and seeing how uneducated they are about risks and risks of not treating and so forth. So I know that the need is there, but I know that those are going to be some barriers that I face in regard to trying to manage time, still not prolonging patient wait times, and having patients be open and willing to discuss some of their risks or their sexual behaviors that they may be embarrassed about, or so on. So those are some things that I have to tackle along the way, but I definitely see a need for that. And I think that it's better that I not limit my project to the expedited partner therapy, but I do think that that will be a component that will help to promote risk reduction and treatment options for patients moving forward.
Okay. Excellent. So, not that it matters, but are you nurse midwife, nurse practitioner?
I'm a nurse practitioner.
Family or women's health?
Women's health.
Okay. And how many providers are in your clinic?
This is another thing that's a little difficult. At a time, there's only one provider.
One per day.
Right. We rotate sites. But we all are on the same page. So every month, right now, we have a monthly NP meeting every month that we call them FPAs, but our medical assistants have a meeting as well. So we all do collaborate together within the sites. But it does range from it's Planned Parenthood of Northeast and South Florida. So we go all the way from Tallahassee, Jacksonville, Gainesville, West Palm Beach, Miami, Boca. There's different sites. So that's another thing that I have to consider is
you have multiple sites.
We have multiple sites, and in my chart audit tools, I don't go to obviously all of those sites, but I can limit, or I can change the data collection to where either I'm collecting data from all the sites, or I can change it to just the sites I go to. I have to kind of figure out what's going to work.
Okay.
Right now, all of us do attend the same meetings though. So, and we do follow the same standard and guidelines. We have access to all of the same, we have a Dropbox that all of us are able to see that has all of our standard and guidelines that we follow within our different offices. So ideally, it'd be beneficial, I would think, to promote, to expand my project, because why not?
Right.
Promote patient care and benefit the patients,
yeah.
Obviously, but it's just, that's more data
So how many sites do you actually go to?
I go to 3.
3. Okay. All right. We're going to get back to this. Okay. Elaine, go ahead and tell us what you got going on.
Hi.
Other than waiting on a baby right now.
Hi, waiting on 2 babies. So hopefully everything goes well and I don't have to step out. So I am a nurse midwife, and I'm not doing my project at the birth center. I'm doing it at a family practice that we work very closely with, but we're not accredited. So no project.
Are you working at a birth center?
I work at a birth center, but I'm not project there.
Okay.
So I am working with a couple of family nurse practitioners to implement a standardized tool for, well, let me back up a bit. So this family practice is very kind of functional medicine, very natural, homeopathic. you get the same type of appointments that you get when you go to the midwife. You're getting an hour appointment. They're going to sit and talk about all kinds of different things. So they don't use any standard tool to monitor the growth and development or for children. They kind of, sit in the office and talk about how baby's growing and how the children.
Okay.
Which is great. It's awesome. Unfortunately, it is not in compliance with some of the state requirements for children who receive CHIPS, which is one of the lower income-based assistance for health insurance for children.
Okay, so that's the state health insurance for kids.
Yes.
And what state are you in? I'm sorry.
I'm in Texas.
Texas. Okay.
And I'm new to Texas, so I'm trying to figure out all of the all of these different things here. So anyway, it's required. They follow the American Academy of Pediatric guidelines for Texas Health Steps is what they use. And so they require a certain a bunch of different milestones when the child reaches them. Different things have to be done, like lead screening and HIV testing and all different immunizations and stuff, which the clinic is actually not in compliance with a lot of this different stuff. So we're going to focus on the on one screening right now, which the clinic feels like they need the most of, which is the MCHAT-R. It's the modified checklist for autism in toddlers.
Okay.
So the plan is that we will make this screening tool available, that the parents can access it through the EHR before they come to the office, in hopes that they can, because it's a parent tool, that the parent can sit and think about what the child is actually doing, so they have more time to focus on it before they actually come to the office. So they'll complete that at home and then come in, and the provider will see the results before they see the parents, so they can talk about any concerns and kind of focus their visits a little bit more if there are any problems. So I will be using, CDC has some really good tools for that as far as implementing those different guidelines, and there's so many that we could use. We're going to focus on the MCHAT right now, just because it's such a big change for the office as far as getting this tool online and getting the parents to get used to use, because this is a clinic where everyone's been coming here for years. They're very used to it. Everyone is very friendly and knowledgeable, and a 30-minute appointment could easily turn into an hour and a half if it doesn't get focused.
Yeah. Okay. So is there a risk in this situation that somebody's going to lose some funding if they don't become compliant?
There is, and I don't know exactly what the risk or the fines are. So I've been talking with the CHIPS people. I don't know their official title, as far as what we need to do to make sure that we were 100% compliant on at least this thing, so that we're at least opening the door for them to know what they need to do next, even when I'm not here.
Okay. Interesting. Okay, and how many providers are in this clinic then? You said there's 2 other FNPs you're working with?
Yes.
Okay. So at least you have a small group at least, huh?
Yeah, it's very small. It's really difficult to find any problems with this clinic, apart from the fact that they're not in compliance, because they really are ideal.
Well, that's great. That's a good thing. But it sounds like you will have some buy-in from them, because they are already acknowledging the importance of this compliance, at least for these. Okay.
Well, this is the thing, is that they requested this project before they even knew about the lack of compliance. So it was my digging around that alerted them to the fact that, hey, we actually really need to do this.
Okay. Very good. All right. So we're gonna back up just a second then. Everybody got the little worksheet out, and they can see kind of what we're trying to come up with. So, Elaine, thanks. So keep in mind that for everyone in the DMP program, everybody has 4 ramps to their project. So there are 4 components that we've got to define and measure. And so those things have to be very operationalized. So for everybody, it's going to include the first prong is team engagement. And team engagement, I think, is going to be challenging for Marissa, because I don't know that you have buy-in and you've got time constraints. It's going to be challenging for Kayla, right? Because they're not really doing anything right now. It sounds like, Elaine, I'm not sure that team engagement is going to be as much of a challenge for you. So when we come back to team engagement, let's talk about either Marissa or Marissa or Kayla's projects. The next thing is patient engagement. So everybody has to, in this process of trying to improve a system, improve the quality, one aspect of a system, in order to do that, you've got to get your team involved, and you've got to get your patients involved. If you don't get buy-in from both of those participants, improvement or change is never going to take place, right? That seems fairly intuitive. But oftentimes when we start going through this project, we sort of forget, because we sort of get focused on the last 2 prongs of this, or the last 2 ramps, which are process changes. And you guys have already all kind of mentioned process changes that you're thinking about. And that's where everybody tends to focus. But those process changes are never going to be sustainable or really spread unless you really weave into the project the team engagement and the patient engagement. Does that make sense? So for each of those 4 ramps, you've got to decide what the intervention is going to be. So in other words, what's the change that we're going to make, that we're going to implement, test in that first PDSA cycle, see if we need to modify to keep going. What's the change? What's the intervention? We've got to define the process of the change and then the outcome. So let's start with the ramp of team engagement. One of you want to, shall we use Marissa's or Kayla's? Who's more worried about their team engagement?
I'm pretty worried.
Okay, go ahead. Let's use Marissa.
I'm pretty worried.
So let's start off by thinking about if your team is engaged, what is that going to look like? What are some of the characteristics of an engaged team?
For me, what I would think that we'd be looking for are providers. Well, I guess it first starts with the FPAs for our medical assistants because they do our intake of our patients, to ask the right screening questions, to not skip through them because they're trying to rush to get into the next patient. If patients ask questions, to help narrow down what it is exactly that patient is here for, so that when we're the providers coming into the room, we're able to better address that patient's particular needs. For the providers, again, being able to take the time out to screen the patients and to educate them, doing the expedited partner therapy. For us, we are allowed to do it. We have to verify partners' allergies. So right now, the way that they have it set up is that if the partner is not present, we have to have the patient call the partner on the phone, verify their name, their date of birth, and their allergies, which is time consuming. And I know that that's why people are not doing it, because we are seeing so many patients throughout the day, and they do check our cycle times and want us to have patients in and out. So to me, that's going to be the hardest thing.
Okay. Well, let me interrupt you, because what you just described to me was really a process change, right? And this is what I'm saying. This is where the focus goes to, is the process change and the outcome that we want to measure. Those are kind of easy. But what I'm suggesting is, you can't just go in there and say, here's the process. You gotta screen everybody. You got to get their allergies. You got to get their phone numbers. What kind of team members are going to be doing those processes? What is the characteristic of the team member that actually takes the time to do those things? Just, I mean, it's not a trick question. It's a really simple question.
I mean, just someone who's patient-centered and wanting to
Patient-centered. I like that. Go ahead.
Patient-centered. I don't know why I feel like on the spot.
And also, I don't want to put you on the spot. I want us all to work together. So you guys just unmute your mics and let's just jump in together to figure out what is it that we have to create in order to get this process to change in our team. I mean, first we certainly have to, they need to feel patient-centered. Go ahead, Elaine.
Oh, I'm still thinking. I don't know. They truly need a reason for them to want to change it.
They need to have motivation, right? They need to be motivated.
And see the impact of the patient care. Do we have better outcomes? Do we have fewer, I mean, you're not readmitting, but are you seeing the same woman over and over and over and over for the same test?
Mm-hmm.
And can we fix that? If as a provider, I'm not treating the same woman every 2 weeks for chlamydia,
Right.
that's a positive. So I don't know.
Well, to some extent, then your team might feel empowered. They might feel that what they're doing is making an impact.
Yeah.
They might feel engaged. I mean, I honestly think that if your team members don't feel like they are empowered and they're motivated, that they're making a difference in their patients' lives, all they're going to focus, I mean, then how are they going to overcome these huge obstacles of time and patient volume and people tracking benchmarking their productivity and all those things that we know they're doing, right? So we've really got to figure out for our team, not a process change for them, but a way to make them feel engaged, motivated, empowered, right?
Right.
Okay, so any thoughts about how we do that with our team?
We have to meet with them. Tell them.
We certainly have to meet with them, yes. What will we do when we meet with them?
Show them some big research that's going to make them want to make that change.
So education is certainly going to be a part of it, I would assume, right? How might we, okay, before we go into how, what else do we need to do besides educate them?
We can recognize the gaps so that they know why it is that we're doing what we're doing, go over some of the evidence-based research that is driving why I'm promoting this team, go over some of the data from the audit that have been done to let them know that the gap exists, and as we continue throughout the project, update them on the progress that we're making, maybe some sort of measurement scale to let them see that in this week we had X, Y, and Z patients in for this treatment, and now by the end of the project we have this many, or throughout the project be able to explain to them.
Yeah, and I do think that's important to sort of present the evidence-based care best practices and point out the gaps in care. That's going to be critical to your project. But even if we do that, so we've educated them, we've explained the evidence-based practice, the best practices, we've explained the gap in care, we still have to get them engaged. We still have to create buy-in, right? It's still, has that taken away their obstacles?
No.
No, it has not taken away the time constraints, the patient volume constraints, all those things that we know are obstacles. So this is really a place to focus. And so did anybody do any research into team engagement? Anybody see any tools for team engagement? That's probably going to be that's going to be really a place to start with this ramp, is looking at team engagement, teamwork, creating buy-in. Because remember, this ramp is not going to be a process change related to a patient outcome, related to, I want my team to make sure they do ABC so that this intervention can change for the patient. This is a ramp that says, how do I get my team engaged and on board with the importance of the project? So for a lot of people, that first meeting that we're talking about, it may be, what's an idea that meeting, how could that meeting look that might motivate people to at least come to the meeting and listen? What might you try?
Besides food.
Oh, well, food's a perfect place to start.
I'm going to hijack a provider meeting that's required anyway.
Yeah.
And say, hey, here's what I'm thinking. And I didn't research formally, for team building, but since we are a private-owned birth center, one of the other CNMs, one of the providers is the owner of the birth center. So for her, unfortunately, I went the financial route. I'm like, we can bill for the insertion of these devices. We can bill for the assessment and for the patient time. I'm like, this is a billable charge. If we could increase these, the charge for an insert and removal of a Mirena is
yeah, absolutely.
And so that's kind of the angle I went with her.
Perfect.
And then the other midwife that doesn't place anything, she's actually a Frontier grad. She started in the home birth setting.
Oh, okay. So she didn't.
No, so it's just, she just doesn't know how to do it.
Yeah.
So I'm like, well, I'm a new grad too. If you and I can hook up with the Nexplanon representative, they'll teach us how to do that. We can do this.
Yeah.
So I think, but really I'm hijacking a required meeting and I'm going the financial route at first.
So I think, joining into meetings that are already in existence, so that's not adding to the sort of the meeting burden, like, oh my gosh, we've got another meeting to go to. I think that's a very legitimate approach. But if you're going to add a meeting, okay, Elaine might have been joking, but it's no joke. We've got to do something to motivate them to want to come. So we could have a kickoff party. We could have a pizza party. We could have an ice cream sundae party. We could have a lemonade stand. I don't know what you're going to do, but the point is you've got to make this kind of appealing to them, would be my suggestion on this process measure. So for our teamwork, the test of change may be, for Marissa, related to her promoting safer sex. It may be that you're going to just literally plan ice cream sundae get together, at the end of the lunch break for 15 minutes one day. However you decide to do it, it needs to be something that can be somewhat motivational. Because nobody just wants to say, oh gosh, I've got another email I've got to read related to something I've got to learn. That's just exhausting, right? So think of this teamwork prong as something that's going to be engaging and motivating for your team. So now,
so can I tell you my idea?
Yeah, please.
We're going to be having an Autism Speaks puzzle piece party. Since our tool is an autism screening tool. So it's going to be kind of like, where do you fit into the puzzle? And things like that, with food, of course.
And I think that's beautiful. I love that. And honestly, hi, Vanna.
So I'm so sorry. I was in Dr. Jolie's class just
Oh.
now.
How did you end up being signed up for both at the same time?
I have no idea. They were talking about run charts, and I was just kind of confused. And I'm like, wait, I don't know if I don't know what happened, but she
Okay.
talks again, and I'm
Okay.
sorry.
Well, you know what? Let me just tell you that we're working on this is the buzz session, and this is where you were on my list, so I think you're supposed to be here.
Okay.
Okay. So if you'll look in the buzz session assignment, there is a measurement worksheet, and the kind of the objective of tonight is to work on that measurement worksheet. And
Yes.
right now we're talking about the first ramp that all of us are going to have, and that is the teamwork ramp. Okay. But
Yes.
okay, you know what, can we pause just a minute? If you other guys don't mind, let's pause just a minute and do you say your name Vanna? How do you pronounce your name?
Yes, Vanna.
Okay. Will you tell us in just a couple of minutes where you're doing your project and the topic of your project and the gap in evidence-based practice that you've identified?
So my project is on the effective use of the 5A's toolkit, utilizing shared decision-making for smoking cessation in primary care. I currently work at Brightpoint Health, a community practice in Brooklyn, New York. I'm sorry, what was your question? My teamwork
Right, so
grant?
you're in New York. So you're a FNP,
I am an adult nurse practitioner.
adult nurse practitioner. So you're going to do the 5A's toolkit for smoking cessation. Do you have any target population?
So I'm thinking about my target population are just mainly adults, tobacco users, of course.
Okay.
So that's who my major focus will be on.
Okay.
Mhm.
How many providers are in your clinic?
We have, let's see, four. We have 4 nurse practitioners and 1 medical doctor.
Okay.
1.
Okay. All right. So we're going to just continue where you are. And I think you can just kind of join right in with this, Vanna. So we're talking about team engagement. We're talking about the idea that that team engagement is not about changing a process for the patient. It's about getting our team members motivated, engaged, convinced, educated about the importance of the project. It's really about getting buy-in from them so that that they'll want to make the change. If we don't start here with team engagement, we're never going to have sustainable quality improvement. We're never going to have sustainable change. So we were talking about a way to consider, we talked about the fact that our teams will need to be educated, motivated, and all that. That's going to come by communication with the leader of the project. But nobody wants to hear about one more meeting they have to attend, or one more email that they have to read, or one more certification they have to obtain. So we were talking about maybe, would your team members be willing to come to lunch if you were going to have a pizza party, or if you were going to have ice cream sundaes or something? And so Elaine is her about screening for autism, and so she was suggesting an art. Tell us, say it again in a nutshell, please, Elaine.
Oh, it's just, food. We were going to do kind of, they have monthly staff meetings. And so I was going to hijack the monthly staff meeting a little bit. And, autism has the puzzle pieces, right? It's kind of their logo, I guess, Autism Speaks. And so we were going to do a puzzle piece party and kind of tie it into, where do you fit in the puzzle of screening for autism? Just sort of kind of a little theme there.
I really like that idea of having a little theme, something that's kind of catchy and memorable. For some reason, when you said that, I had this idea of, a kid's puzzle with about 20 pieces, and everybody gets a piece, and something's written on the back. When you put it together, it kind of has a message related to your project. I don't know. All I'm saying is that this test of change for team engagement is something that is going to get your team motivated, engaged, encouraged, and educated, sort of thing. But it's not going to be, oh, here, read this email, complete this. I mean, that's not motivating or engaging. Does that make sense to everybody?
But a party or a meeting or anything like that isn't the end of it, is it? I mean, we have to evaluate.
Correct. And this is just our first, this is where we start with our first PDSA cycle.
Okay.
And then we'll see how that goes over the first 2 weeks. And if that seems to work really well and our staff seems engaged and motivated, then we may just have 2 weeks later another little follow-up meeting, get together at the next staff meeting or whatever. If that seems to be a complete disaster, you may decide that you need one-on-one 5-minute mini sessions with your team members, particularly if you have a team member that seems to be resistant to the idea. You may end up having a contest, which team members could be involved in which the team member that screens the most people or does the most of your interventions, like it. So if Marissa is trying to provide education, the team member that participates the most may win a prize, and that may be, I don't know, a $20 Starbucks card. I don't know. It's, but still. But I mean, that's motivating. I would try a little harder. Okay, so that's kind of, so you can, right, so that it's a good question, Elaine. Where you start off is not necessarily where you're going to stay with this. You're going to start, you're going to do the first cycle, you're going to measure your team engagement, and you're going to evolve from there. Which brings me to, so the process measure, all right, so let's say, Marissa, do you have an idea of let's throw out an idea for you that you like. It doesn't matter. Let's just say you're going to choose one of these things we've talked about that you think you might want to try.
I could do like a breakfast bagel session, something like that.
Perfect. Okay, so
will attract, I know.
Yeah, that's perfect. So we're going to have a breakfast bagel meeting. I love it. So how are we going to measure? What's the process that we're going to measure now to determine if our team is engaged for you?
We could compare how many people attend that in comparison to how many people were invited. And this is where I'm going to have to really decide if I want to keep it. If I do something like this where I'm not just hijacking a meeting, then I'm going to have to keep it more local, because obviously people are not going to come all the way from Tallahassee for some bagels.
Right.
But if I can keep it more local if I do something along this route. Otherwise, which I think may be better regardless, and it will allow, I feel like I will better be able to keep the team engaged if I do it that way, because I can make it more fun and interactive, as opposed to just having the meetings.
Online. Yeah.
Similar to this, yeah.
And also that's ideal, because remember that when you start off, you're going to start small. So in the end, this project may spread and become huge, but in the beginning, it is going to start very small, and you are going to start with a number of people for which you can buy bagels. So that's a very good place to start. And I think your process measure may be, in the beginning, the number of staff invited, the number of staff that attend over the number of staff that were eligible to attend or invited or whatever. But then the question is, what's your outcome measure for your team engagement?
Now, is that more long-term, or is that the same? Like, for example, let's say week by week, I'm taking how many people attended this first meeting in comparison to how many attended the second and the third, and finding the average of that. That could be an outcome measure. But
No, that's going to be your process measure all the way. That can be your process measure all the way through. But an outcome needs to be something that changes because they attended. So there are different ways to measure this. Some of you may decide that you want to have them do a very short survey using a Likert scale that's got 3 or 4 questions, so it literally takes them 30, 40 seconds to fill out. And it kind of, you try to measure how engaged, how much it tries to measure their buy-in. So it may ask questions like, how important do you feel it is to treat patients' partners? How important do you think, I don't want to make up, I'm not making up your questions for you here. I'm just pulling something out of the air. But so that's one way. You could actually have them do Likert scale surveys at these meetings when they attend, and then you'll track those surveys results. You may actually consider having them. Another theoretical outcome would be that they're willing to administer. They're willing to collect the information from the patient. So if they're collecting the information, then that's an indicator that they're engaged, right?
Right.
So it may not be a survey. It may be more that you're finding that your assistants are willing to complete some data that they weren't previously completing or something of that nature.
Okay.
All right. Anybody have questions? Yeah, go, Elaine.
Sorry.
That's
so
okay.
that's kind of what I was thinking about doing for mine. And then, so I did some research, and there's lots of different types of existing Likert scales that you can do to administer to see, team engagement and that kind of thing. But they're really complicated. No one's going to fill them out. Can this be something that we do on our own?
Yes. You can modify. I wouldn't suggest anybody just try to come up with their own Likert scale for team engagement. But if you find a Likert scale or 2 or 3 that you like, use one question from each of them, or one question from each section, because I'm suggesting a questionnaire that's no more than 5 questions, maybe, that literally they can fill out in under 2 minutes. 1 minute is best. Just boom, 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 3 or 4 questions. Consider having one open-ended qualitative question that says, I don't know, for Marissa, what's your open-ended question? But you might have them say, what's the most important thing to teach our patients about safe sex? Or what's the most important thing about this project? Or what did you like about this project? Qualitative data will give you a different side of it than the quantitative. So some of these tools, remember, you might want to have one question that they could answer very simply with just a few words.
I have one question.
Okay, go ahead.
In regards to the teamwork and in-service training for our staff, can an outcome measure be to increase team member screening and intervention as documented by the chart audit? Because, if we're educating them, we're hoping that they're doing it.
Right. It could be, but keep in mind that if one of your process measures that we're going to get to in a minute here is screening, you can't have the same measure count for the team engagement and the screening. Okay. Does that make sense?
That does. Okay.
So for Marissa, I'm sort of thinking that screening her focus isn't going to be on screening. I'm thinking probably one of your process things isn't going to be screening. So this may be a thing where I know you're not calling them MAs, but you know what I mean. Your FPAs, just their participation by gathering the information for you is an expression of their engagement, because they are buying into the importance of it. Okay, let's move to patient engagement. Who wants to talk about ideas related to their project and patient engagement? Anybody have any volunteers?
The one form bit, I guess you could say, of patient information that we have in the clinic regarding contraception is a sheet that lists every available form, from natural family planning all the way down in level of effectiveness to tubules and vasectomies and IUDs. We have those forms, but we don't give them to our patients
Okay.
unless the patient specifically asks. The patient has to ask us. We don't say, what are you thinking after the baby's born for contraception? Anything? And when she looks at you like, well, I don't know. We could give her this just to plant the seed.
Right.
Like, these are your options. Start thinking about this kind of it's like a decision aid sort of, because it lists everything that is available. And I thought, well, I could kind of measure it by just new OBs, just start with the new OBs and how many of them did we give the paper to versus how many OBs we saw. And if we could get an understanding, my outcome would be like, our new OBs understand what their contraception needs are, whether they
Okay, well, let me pause right there and say that again, I think this is a process measure. This is not a patient engagement measure. So this may be one of your interventions because clearly the gap in care that you've identified is that your patients they're not being given anything related to contraception. Yeah. So clearly, I think one of your two process measures is going to be, you've got to give your patient some written and verbal information, right?
Yeah.
So let's back up to the patient again. Okay. And then we're not going to the processes yet. But in your clinic, I already know your patients are not engaged in contraception conversations because you got those sheets. They're not asking for them. No one's doing anything to engage them. So from the standpoint of the project, what are kinds of things that we could do to engage the patient?
So I found a tool online called the SURE tool, and it pretty much, I guess, helps you to understand whether you use shared decision making successfully with the patient or not, because there's 4 questions on this toolkit, and it's a yes or no response. And the yes, there's 1 point for yes, no for 0, 0 for no. And the questions are like, do you feel sure about the best choices for you? Do you know the benefits and risks of each options? So there were 4 questions. So I'm thinking about utilizing this toolkit survey that
Yes, I think that's a great idea. And the answers are, and tell me how that survey, the answers are.
Oh, yes is number 1, no is 0. So the total amount would be 4.
Yeah, excellent. And that would certainly, that's a fantastic measure for patient engagement, right? That's the way we're measuring it. So that's sort of our, if we're going to have an operational definition of our process, it may be the result of that SURE survey, right? But how do we get our patient engaged in the first place? And I think that the answer, and I think Vanna and Kayla, your projects are very different. We have smoking cessation and we have contraception, but nonetheless, we've got to somehow motivate it. Again, it's the same thing as with teamwork. We've got to motivate, engage, educate our patient. We may also even need to know about their interest. Okay, for smoking cessation, are they interested in stopping smoking? Do they have a readiness? Is there any level of willingness to change or readiness to change? That's another way to look at it. But in the end, we've got to have some way to get our message across to our patient that we feel like it's important that to engage them in this contraception about contraception or this conversation about smoking cessation. So how can we engage our patients about those important conversations? What are approaches that we could use? Thoughts from anybody?
Well, sorry. I also found another tool, another approach called a SHARE approach, a model for shared decision making. SHARE stands for seek your patient's participation. H for help your patient explore and compare treatment options. A for assess your patient's values and preferences. R, reach a decision with your patient. E, evaluate your patient's decision. So would this be a process measure?
I think this is a fantastic tool right there that you've described. I think it would be perfect for smoking cessation, for contraception. It would be perfect for conversations about safer sex, right? Um, and then I'm sorry, what am I leaving out, Elaine? Oh, yours is a little different. What are we going to do for you, Elaine?
I'm a little stumped because well, I'll tell you what I put when I was kind of filling out this chart is that my patient engagement was going to be documenting education that they were given, because they cannot fill out this tool if they don't know about it. And so
Right.
we need to
And
get.
they can't choose LARC if they don't know about it, right? They can't. I mean, we can sort of apply that same concept to a lot of them. So,
Right, but this is that it's different because if they're educated about the LARC, they may choose to do it or they may choose not to do it. And I guess it's the same with the screening tool. But if they choose not to do it, then I don't know.
well, let me jump in and say and tell you what this patient engagement test of change is not going to be for any of you. Please don't ever let me read this. It's not going to be that you just handed them that piece of paper.
Right.
Because that doesn't really, that just from a realistic standpoint, that's not really very engaging, right? So it may be, it'll depend on your setting. Some people have phone apps that they can use to help engage some of these or encourage some of these conversations. Some of them will have it may be a poster on the wall or something that, maybe there's something about the autism screening that is available for patients that's, more something that hangs on the wall that's engaging to the children. I don't know. It's just not really sufficient to hand them that sheet of paper without documenting some kind of a conversation or education engagement.
So the problem we're going to have is that we're not going to see the patient until they come in.
Okay, so this is going to be something that's probably going to have to be done
over the
online
phone
then, or on the phone.
Because they're going to have to call and make their appointment, and we're going to say, great.
Okay.
Appointment, we're doing this, and we're going to have to educate them why we're doing it, and what is autism, what are we testing, what are we screening for, why we do it, how you go and do the test. And then the other thing I can think of is that we can put something when they click on the link, something that educates them or links them to Autism Speaks website.
Okay, right.
The break starts or whatever. That's all.
Right. A link on the website, an email, a letter that gets mailed, any of those things are a place to start. But just remember that just handing them a piece of paper isn't terribly engaging.
Right.
So now it may be, there's a lot. You may also look at motivational interviewing. That is an approach that works for a lot of these things, particularly possibly for smoking cessation. So if you have your adult tobacco users that you're already aware of because they've answered that question on their chart, it may be that there's going to be a very brief encounter with of motivational interviewing for your patient that takes place in 1 minute or something like that. We can't ask our participants to add 15 minutes to a patient visit. That's not sustainable. But there's a lot of information out there about motivational interviewing that's done as a brief intervention. So that can be part of the SBIRT approach. If you're screening and then you're doing a brief intervention, that brief intervention could be motivational interviewing. Getting back to Kayla, for her for our LARC placement.
I found an article using Facebook for like a patient just information FY little study thing. They were throwing this information out on Facebook for a patient engagement, even like sitting in the office at, like on the birth center has a Facebook page. So throwing
Yes,
something
love
like
it.
that
love
out
it.
there.
And you may just have something somewhere in the process of the patient flow that alerts them that while they're waiting, this is on your Facebook page. I love that. You guys are thinking in the right direction. So this is what I want you to be Googling, searching in your databases is patient engagement, because we're not handing, okay, Kayla, we know your piece of paper has been at your office all this time. So the paper isn't engaging, but Facebook is engaging. That paper could have laid right there on the table next to them. They would have never picked it up, but they were on because they were on their phone the whole time on Facebook, right? So that's the way to be thinking. I love where that conversation just went. Okay. All right. So we're going to decide on some kind of test of change for our patient. It may be a Facebook app. It may be a brief moment of motivational interviewing. It may be sending out a link to the patient. I think a lot of, tell me if you agree with me, Elaine, are a lot of parents, when they see this opportunity for autism screening, they may just automatically be interested in that, and because it's kind of a hot topic item right now. Do you think there will be interest for it?
I think there would be. I would struggle a bit with the Facebook because the office doesn't have an active Facebook page.
Yeah, and that may not be the approach for you. That this is probably something that's going to have to. The point of contact for you is when they call to make their appointment.
That's
so whether
going to be the biggest thing.
Yeah. So then we'll decide. You'll decide on your process. You'll decide on if it's going to be a brief if it's going to be motivational interviewing. Then you're going to be kind of looking at the number of adult smokers, adult tobacco users, divided. So the number of people that receive the motivational interviewing over the number of adult tobacco users for the day. That was a really simple one. If it's a Facebook app, you might look at the number of people you saw in the day, and the number of, that's a little bit tricky to follow. You could certainly look at the number of people that you had look at your page. Whether or not you could tell that they were those patients would be a little tricky. But this is the way to be thinking. Does that make sense to everybody? And then what's an outcome going to be then for these kind of, what's our outcome measure? Those were process measures. What is our outcome measure for our patients, for patient engagement?
Could it be number of smoking patients participating in survey over total number of smoking patients?
Well, it could be, but why wouldn't it be the results of the survey? If the survey is asking for readiness to change, or interest in having the conversation, that's really the measure of the, that's the outcome right there, is the results of the survey. And the process measure may be the number of patients that were willing to participate in the survey. Does that make sense?
Yes. So could it be the average mean score on the survey, or like a score of 3 and up? Okay.
Right. Yeah, there's probably different ways, but right, you'd have to decide like what your goal was. Like you may want your goal to be, 4 or whatever. There'd be various ways to set that goal. But the main thing I want you to be thinking about tonight is, what's the outcome measure going to be? How are you going to define it? Okay? And keep in mind, when you start to implement your projects, all 4 of these ramps have a process measure and an outcome measure during each of the 4 PDSA cycles. So there's really 16 kind of measurement things related to these 4 ramps, right? Because you have 4 ramps and 4 cycles. And then there's a process and an outcome measurement throughout. It can get tricky as time goes by to keep the pieces pulled, the strands unwoven, because they kind of tend to weave together, particularly when you start measuring people that are screened and then people that receive an intervention. It all sort of melds together, but you want to be able to express these things separately. Okay? All right. So we've already talked a good bit about process changes, but somebody want to chime in and say what they think some of their process measures are going to be. So we're going to have 2 different approaches. And so, Marissa, I know we were just talking about your project, but yours is a brilliant example of how this can work. You may have one process to, however you decide to do it, increase education related to safer sex practices.
Right.
But the other process may be expedited partner treatment.
Exactly. That's what I figured. Once I started to see that there was no way I was going to be able to make that my whole project, I figured that that's something that I can make at least one of my processes to implement. So I do want to do that.
So the thing about the promoting safer sex, you'll just have to find a toolkit that provides you some very efficient, quick, implementable education tool. And I don't know, maybe there is an app. The CDC has a lot of apps about safe sex. Maybe it may be just that patients receive that CDC website information or app information and are able, just give you a verbal report that they actually looked at the app. I don't know. I'm kind of giving you some ideas off the top of my head.
I'm writing them down. They're good.
What are other people, who else wants to chime in and talk about 2 different processes that you're going to use related to their implementation?
Well, I'm going to get some devices for show and tell, like the little Nexplanon where they can touch and feel what it feels like under the skin, actually see it. Same way with the IUDs, get a Mirena and a Paracard so they can actually see it. Like, oh, well, this isn't some huge scary thing that's going to be in my uterus. No, it's tiny. It's like an inch. And I think being able to touch and feel will help with that's what that is. Okay, make it not so scary. It's not what was that back in the 70s, the Deckle Shield.
Yeah, the Lippy's loop or what? Yeah,
gave everybody GBs about an IUD. So I want to do that component, and then I would like to get involved in. We have 2 childbirth educations. We have a part 1 and a part 2, and the part 2 is from the time the baby's born on for postpartum. And I would like to have maybe 10 or 15 minutes of that class to do some slides and some show and tell outside of the clinic. So it's not so time consuming with the office day, or a couple of my ideas anyway.
Yeah, and those are good interventions. Now think about the fact that for each of those interventions, you've got to measure the process and then the outcome. So if you've got show and tell items in your waiting room or in your exam rooms, you've got a uterus model with a Mirena, and you've got a Nexplanon and all of that, you've still got to measure so what? Did they just sit there, and did anybody ever touch them? Did a provider ever have a conversation with that patient related to these items? So you said in your chart somewhere you've got a block that says contraception discussed or whatever, right? So one process measure may be not only not just check that box, but a plan is documented.
Actually say what they showed the patient. Yeah, that's what I'm hoping for.
Right. That what they showed we discussed it. We showed the patient the Mirena and the Nexplanon or whatever. What's the outcome measure for that test of change then?
I said, I said like maybe that 80% of the women who were shown that device actually went on to choose it for their form of the patients desiring contraception. Like 80% would chose a LARC method who were shown
Right,
the
right,
devices.
right. Okay, well, keep in mind that in 8 weeks, that's going to be pretty hard to measure, particularly if we're talking to people at new OB, which maybe we are, or whatever, or at the 28-week visit, or certainly by the 36-week visit, but probably you're going to find that it should be done way earlier than that. So it may just be that the patient verbalizes what their choice is for LARC or not. I think this is an important thing, that the patient has become part that shared decision making. So I think this is a shared decision making. I think that's the place to look with this, and that the patient has been the decisions have been discussed with the patient, and then they have expressed what their decision is. Same thing, and I think you could do a very similar thing using the childbirth education, that class, and have that's your test of change by inserting this contraceptive discussion in there. And then with that one, you're going to have to figure out how you measure the outcome. So that could be a very simple little, it could almost be some kind of a little fishbowl assignment. As the patient comes in the room, put a yellow ball in the bowl if you know what you want to do for birth control. And as the patient leaves the room, put a yellow ball in the bowl if you know what you want to do for birth control. I mean, think of things that are incredibly quick and easy for patients to, ways to survey. So fishbowl surveys are beautiful. It takes 3 seconds. It only answers one question, and it can only answer it with a limited number of answers. But I can do it as I walk by the bowl, and it's sort of fun. Throw a ping pong ball in the bowl or whatever. Okay? All right. Anybody else have questions, comments that they want to make about their interventions? Vanna, do you have 2 ideas? Did you already kind of throw around 2 ideas?
Okay. So for my 2 process, I have the first one is the 5 A's toolkit, which stands for ask, advise, assess, assist, and arrange. So the process measure is to utilize this toolkit in tobacco use screening on 90% of patients.
Okay.
So it's going to be like the number of smoking patients over the total number of smoking patients seen that day.
Okay.
And then
the number in which it's used over the total number seen.
Yes.
Yeah. Okay. And then what's your outcome measure for that?
Increase the number of patients screened for tobacco use with the 5A toolkit.
That sounds sort of like this. Does that sound like the same thing? So if you've screened them, so the process is we're increasing our screening, right? We've got the number of patients screened over the number of total tobacco users for the day. So the outcome measure may be more of the result of the screen, like number of people that are, because what is the 5A? What are we learning from the 5A's toolkit?
Well, these are like 5 easy things that practitioners can do with patients. Just asking, number 1, are you interested in quitting? Yes or no. And then advising them, urging them to quit because of the harmful effect of cigarettes. And then assessing their readiness. And then assisting in whether it's behavioral therapy you're providing or pharmacotherapy. And of course, arranging for like a 1-week follow-up to see how they're doing.
So your outcome measure may be like the referrals to prescriptions for Chantix, referrals to whatever you're going to do with that. So you find a patient that is a tobacco user and is expressing a willingness or readiness to change. Then what do you do with it? So that may be your outcome measure, whatever you decide you're going to do for that patient that expresses that, whatever the referral is or the treatment is, the management.
Can
So
it be to increase behavior therapy and pharmacotherapy intervention?
Right. So if you have but it cannot be to increase behavioral therapy intervention if your patients don't have an option for behavioral therapy intervention. Do you see what I'm saying?
Okay.
Because people will plan that and then realize there's no resource in the community to refer their patients to. And then everyone is just incredibly frustrated about it. But, you understand what I'm saying? So if you can, like for instance, don't say one of your outcome measures is going to be pharmacological treatment if you don't have the ability to prescribe the medication, because then you can't help the patient. It's got to be about the outcome for the patient and how can we measure that we've improved what we've done for them. Does that make sense?
Yes.
And I only say that because I promise you every term I see students that say, we're going to screen for substance use and then we're going to do motivational interviewing, but they have nobody to refer those patients to. And so it makes me a little bit distressed, because I'm like, you've identified your patient and you've also acknowledged, you've even identified some readiness to change, and yet we don't have anything to give them. So that you've got to have that last piece. What is that last piece? What are we going to do with them? And so your outcome measure then is how many people do we refer on to that pharmacological treatment or behavioral treatment or whatever. Okay.
Okay.
Now, and then what would your other approach be?
The next process is audit checklists.
Okay.
So utilize a preclinic audit checklist on 90% of patients. So it's going to be the total number of chart audits of smokers completed over total number of smoking patients seen that day.
Okay.
And the outcome is to increase documentation on screening and intervention.
Okay. That's reasonable. Just make sure it can never be all about screening.
Oh.
Screening in and of itself is just busy work. If the screening doesn't result in an improved outcome for our patient, then nobody's going to buy into that. Neither the staff nor the patients. All right, Elaine, tell me where are you going with your two processes then?
Well, that was a scary last few statements that you just made, since my entire project is screening.
Now, that is a really yes, it is an interesting point. So what are you going to do with, now, here's the thing, in 8 weeks, are you going to have a positive screen?
Maybe not.
Maybe not.
But
do you have a plan for a positive screen?
I do have a plan for positive screen. So let me tell you about these two process measures that I have here. And so one of them is just that the parent is going to, and I'm shooting for 50% of the parents to complete the MCHAT-R screening through the EHR prior to the well child visit. 50% of the total well child visits for that particular time period. And then we'll measure it, the outcome measure, by an increased number of patients that are screened for autism by using this tool. We're going to increase it from 0% to 50%. That's the goal, because these clients are not used to doing anything online. So it's going to be a change for them.
Okay.
And then one of my other, I'll change the process by introducing an iPad in the clinic for them to try it. That'll be kind of our next cycle, is we'll do it in the clinic and see if we get more responses. And I think we will. If we have the opportunity to do it in the clinic while they wait.
Yeah, I think that's a great idea.
And then, there's when you fill out this screening tool, it falls into 3 different categories, which are, very low risk, or a moderate risk, or high risk. So we're kind of putting a plan in place for that. And then the high risk, our process measure is actually to refer 100% of all screened children that screen high risk for early intervention or evaluation.
Okay, good. And you have the occupational therapists or whatever that are in the system somewhere where you can get your
Right.
patients to. Okay,
Right.
perfect.
Actually, an autism early intervention decision aid that I could use. I'm not sure where it falls into play, if it needs to get quite that detailed. I don't know. But there
Okay.
is a decision aid tool from the University of Queensland that we can do if the parents are having difficulty deciding what type of therapy or evaluation they want to do. Because like I said, I mean, this is a different type of patient population where they're not going to vaccinate their children, so they're going to have a harder time believing that their child is autistic, if that makes sense.
Yeah. Okay. All right. Well, I think you guys are all off to a good start. Anybody have particular questions or comments? Then, okay, once you've got, so did everybody make some little notes on their little worksheet? You have some little notes written? Are you beginning to, thank you, thanks for sharing. Can you make a statement over here that's basically summarizes your specific aim? Once you kind of pull all these together, what we're trying to do is then have a specific aim statement, which kind of gives an overview of the whole project. It's going to get teased out into these 4 ramps, but they all correlate straight into that specific aim. Does that make sense? You want to share? You want to share yours with us since you got it in your hand, Vanna?
Okay. So my aim is to increase the percent of tobacco use screening and intervention using the 5 A's and shared decision making by 90%.
Okay. And then of course you'll have an end date on that.
Yes.
Yeah. When you're doing your,
Oh.
It'll just be basically the 8th week of the, intervention base or whatever.
But by September 1st?
Yeah, something like that. Yeah. And then but then remember, that's the way it's written while we're implementing. And then when you're all done and you go to write it up, you write it in like an 8-week time frame or a 10-week time frame. The end date only applies while we're implementing. Once it's done, then you kind of give the time range. You can say a roughly 3-month period, whatever, however you want to summarize it. Okay? All right. I do think you guys are all off to a good start. I think you've got some good ideas. Just, again, it's one of the hardest things is to remember that the team and the patient ramps are really, they're really the foundation of the project, right? The change is never going to be implemented if the team engagement and the patient engagement is not accomplished. But so often we forget about those goals. Everybody's thinking about the process measures, the tests of change related to the processes and the outcomes for those processes. But back up and start with your team engagement and your patient engagement. Just do exactly what you guys were doing tonight. Just Google it, get on there and see what you find. And there's some really good surveys already out there that are quick and easy, 1 or 2 or 3 or 4 questions. There's just lots of different ideas. Okay? All right. Anybody else have any questions, comments?
This was just very helpful for me. I made a lot of notes and I had a draft of what I thought my measurement worksheet was going to look like, but I need to go back and fix a few things. And I just wanted to say thank you to Vanna for sharing those tools.
Yeah, those were great and perfect. And Vanna, can I just ask you out of curiosity, did you just Google those while we were sitting here?
No, I had them.
You've been looking at these before?
Printed out as well. And I was just looking up, another one where the SHORE Shore Toolkit from AQUA, and I have it saved on my desktop. But
Did you find those in a database search? Do you remember?
I found it on like a Google search, but I'm
Okay.
trying to find it again, because if you type in Aqua Shore Tool, you can't really find it, but I found it somehow. So I'm trying to, that's what I was trying to find, that specific website.
One of the best ways to find it is just Google like a patient engagement tool, patient engagement survey, team engagement, the same thing. And, you know, it's kind of easy to come up with the idea of, you know, bagels for breakfast one morning, but it's a little trickier to measure the process and measure the outcome of that. So that's where you might want to look at some of those kind of tools that are already out there. There's no reason to kind of try to invent something. Those things are out there. There's a plethora of them. Okay. All right. Well, I think you did great. I think that's pretty much covered what we need to cover. And I will put the link for this back on the sign up page for the Buzz session. So if you had questions, if you missed something, you wanted to try to come back in and listen to it, you'd be welcome to do that.
Okay, quick question.
Okay.
This
Yep.
measurement worksheet that we worked on tonight that's due on Friday, it kind of rolls over into the improvement project charter thing, right? Or is that
It completely rolls over into that charter, exactly.
okay? So the charter's not all new information. This information.
The charter is going to just come from the assignments that you've been doing. Are all building up to just go straight into that charter, and you don't actually have to turn in this worksheet. That was for you to take notes on this. I mean, as you're doing your literature reviews and all of that, you'll take notes on it. But then tonight, and then, but have it handy. All these notes, when you go to do that charter, you're going to bring all of this stuff right onto there.
Okay, that's what I was hoping. I'm like, I hope this comes across, and I don't have to come up with all these new.
Yeah.
Yeah.
No. This is, you know, that's all the assignments up until now. We're trying to build you towards being able to think through these pieces, but you kind of have to be exposed to a lot of them before you can put them together. If you run into a brick wall, if you have a particular question about something, then what you would do is just email whoever your continuity faculty member is. And I don't think I have any of you guys. I don't know how that happened. I'm sad that I don't. Can I move you all around? Anyway, okay. Thanks for joining in. Thanks for participating. I think you were excellent.
Thank you so much. That was really helpful.
You're very welcome. Y'all have a good night. Alrighty. Bye-bye.